Appreciate it. Thanks for allowing me to ask the questions, and I really appreciate the panel being here. This is such a very important issue. It affects all our districts. Mr. Chester, a lot of people are aware of opioid abuse like Oxycontin or heroin, but not fentanyl. Is that the case? And then what are the educational outreach programs currently underway, and what resources are available for communities who want to get the message out? I think that's important. If you could answer that question, I appreciate it.
Yes, Congressman, as I stated earlier, kind of the components of how we're dealing with this comprehensively is to prevent initiates to drug use, provide treatment for those who are addicted to these drugs, and then stop the flow of the drugs coming in the United States. In terms of prevention, one of the primary mechanisms that we use in ONDCP is the Drug-Free Communities Program. The Drug-Free Communities Program, which is funded by ONDCP and is managed by the Substance Abuse and Mental Health Services Administration, is in thousands of communities around the country, is a prevention program that is focused on individual needs of individual communities. Local communities require local solutions, and it's a coalition of 12 community members that are focused on the needs of that particular community, not only to raise awareness of drug issues, but prevent primary drug use or initiation of primary drug use, focused on a demographic of about 13 to 17 years old, which is the target demographic for that program. Very effective program.
It's been effective. Okay, very good. Mr. Milioni and Mr. Allen, are you, as you mentioned earlier, China announced its intention to ban the manufacture and sale of 4 additional types of fentanyl. Can you discuss our working relationship with China to prevent entry and sale, and are there mechanisms to hold China accountable to its commitment to ban fentanyl?
Our relationship on the law enforcement working level has been tremendous. Our administrator, acting administrator Chuck Rosenberg, was recently in China, met with our counterparts. As a result of those meetings, and shortly thereafter, in working with the State Department, they agreed to schedule these 4. One of them, carfentanil, which is about 10,000 times more potent than morphine. These are significant steps. The other positive thing has been when they've initiated investigations in China, there's been real bilateral sharing. They've provided us leads of domestic-based distributors that are ordering fentanyl, and that's really helped flesh out these networks, and now these investigations are ongoing. So we've been very pleased with the cooperation. We hope it continues, and certainly it can expand.
Very good.
And I would only echo that. The Chinese government has provided DHS with seizure information about seizures made in China on their way to the United States, and we've been able to use that information to, as Mr. Milioni said, identify other individuals and organizations that have received shipments from the same points of origin in China that has allowed us to begin investigations.
Thank you.
Finally, Congressman, if I could add one more point
go
from the
ahead,
State
please.
Department side.
Please.
Beginning a little over a year ago, we reached a bilateral understanding with the Chinese government that they would control the delivery of products from China to the U.S., even if they were not controlled in China, if they were controlled in the U.S., in exchange for which we made the same commitment to them. Now, it's not enforceable in any sort of international organization, but it is an agreement that we reached between ourselves as 2 governments.
Thank you. Dr. Oury, in your testimony, you mentioned that CDC is committed to giving providers and health systems the tools they need to improve how opioids are used and prescribed. Can you discuss these tools and how communities can take advantage of these tools?
Absolutely. We've really had a multi-pronged approach. One is just through education. We've been working directly with medical schools and nursing schools on preclinical training on effective pain management and safe prescribing practices. We've also developed 7 continuing education webinars that are available for free for providers on our website around safe prescribing of opioids. And with the guideline itself, I'm a practicing physician. I know you have to have something that you can use. So we have a checklist that's been downloaded more than 25,000 times by providers to use. And we also now have a mobile app on our phone around the guideline that has things on motivational interviewing and how do you talk with a patient about these difficult decisions on whether or not to give an opioid, a calculator to help you calculate what's the appropriate and safe dose of an opioid to give. And we are also, we've piloted a community education program and awareness around the risks of opioids in 10 cities that were hardest hit.
Very good. I'd like to talk to you about possibly coming to my area in Florida, the Tampa Bay area, if you haven't already.
I would welcome that.
Thank you very much. I yield back, Mr. Chairman.